CoverLipedema.com presents UnitedHealthcare Policy on Liposuction for Lipedema, what it means for UHC members. CoverLipedema.com has been dedicated to helping women with lipedema get their surgery fully covered by insurance for over 3 years. Lipedema is a disease, and surgery to treat it should be covered by health insurance. There is no reason that you should drain your savings or borrow money to pay for surgery. Coverage is your right, and we've helped almost 200 women get covered over the past 3 years. We have a wealth of knowledge, connections, and data that make insurance coverage easier to obtain than doing it by yourself. In 2019, UnitedHealthcare was sued through a class action lawsuit for failure to cover liposuction treatment for lipedema patients. To defend the lawsuit, UHC shifted from arguing that liposuction for lipedema was cosmetic to arguing that it was unproven as a treatment. While the lawsuit dragged out for the past 3 years, CoverLipedema.com has overturned UHC denials many times and obtained millions of dollars in coverage for women with out-of-network surgeons. We knew that the lawsuit would most likely only result in a basic coverage policy at best. Because of that, our goal has been to establish data and precedent for fair payment of qualified lipedema surgeons once that policy was created. We communicate with the UHC corporate team and strongly advocate for fair coverage of lipedema patients with them often. In July, UHC settled the lawsuit and promised to expand coverage of liposuction for lipedema. In the past few weeks, UHC has published a medical policy on liposuction for lipedema that will be effective October the 1st. The policy applies to commercial plans nationwide and for the plans in states participating in the insurance exchange: Arizona, Maryland, North Carolina, Oklahoma, Tennessee, Virginia, and Washington. UHC has not updated the policies for Oxford, a plan that it owns, or for its subsidiaries UMR or Medica. UHC has also not updated the policies for Medicare or Medicaid. However, we expect, as with other insurers, the same requirements will be enacted soon for self-funded employer plans, for federal employee plans, Medicare, and Medicaid. Self-funded employers can decide whether or not they want to cover lipedema surgery. We've had employers like Wells Fargo refuse to change their policy or even allow plan members an external review. Other companies, like Raytheon, have made exceptions. So every UHC member planning to get surgery should be aware of these requirements. As soon as other policy updates are released, we will post those updates on our website, our Facebook page, and our Facebook group. The new UHC medical policy calls for 6 or more months of conservative treatment. In the plan, conservative treatment includes non-surgical interventions, which encompass adhering to a healthy lifestyle through diet and exercise, complete decongestive therapy, that is bandaging, compression garments, manual lymphatic drainage, and emotional, psychological, and social support. 6 months of conservative therapy instead of 3 months is the biggest departure from what at least a dozen other insurers require in their policies. Insurers know that conservative treatments don't work for lipedema, but that will not stop them from denying people who don't have them well documented. We have had denials based on poor documentation of these treatments, even from Anthem and Aetna, which have coverage policies, and expect increased scrutiny of conservative treatments as more women ask for surgery. So far, no insurer has required that compression or manual lymphatic drainage be medically supervised. Women have been covered by providing receipts from self-paid MLD and from online purchases of compression garments. If you have a FlexiTouch, that's great, because it combines compression and MLD. Compression garments should cover every area where surgery is planned. Insurers, even if they have had policies for years, don't seem to train their employees who review lipedema surgery coverage requests. With FlexiTouch, for example, patients must explain that it combines compression and MLD. When coverlipedema.com assists with a member's coverage request, we ensure that the prior authorization staff of the insurer understands lipedema and its treatment. When there is a failure to understand lipedema or its treatment, we know who to contact at insurance companies to address issues caused by this failure. The diagnostic criteria for lipedema in the UHC policy is standard and reflects the diagnostic criteria that we require for our physician diagnoses. The surgeons and non-surgeons that coverlipedema.com recommends are familiar with these requirements. We also suggest some additional requirements that are based on insurers with more extensive criteria. UHC, however, has stricter criteria regarding high BMI over 35 than most other insurers. All insurance plans require the documentation of failure to respond to weight loss activities or procedures. The UHC policy requires that medically supervised weight loss has failed for high BMI patients. The failure of the limb adipose hypertrophy to respond to recommended bariatric surgery or other medically supervised weight loss modalities, as stated in the policy. The policy does not state that women with a high BMI need to try bariatric surgery or diet drugs to get covered. Bariatric surgery is far more invasive than lipedema surgery, and coverlipedema.com has worked with many women who are able to lose excess weight after removing painful and disabling lipedema tissue. Diet drugs have cardiovascular and other risks, and if you're eating a healthy diet anyway, they might not be something that you want to take. The key thing that we tell women about insurance is that you control your coverage request and its supporting information. We've had physicians recommend bariatric surgery or diet drugs prior to surgery, and if you don't think that's right for you, tell your physician, and if they don't listen, find a new one. CoverLipedema.com also has a dietitian we can recommend who understands lipedema and does do reasonable online consultations. When you work with CoverLipedema.com, we guide you in creating a coverage request that would meet all the criteria of the UHC policy. After our members create their request package, we carefully review them like an insurance company would. We usually suggest changes that help you better fit the insurer's criteria. We often have physicians modify their notes and letters to make a stronger coverage request. We also provide support in situations where there is obesity, especially regarding getting liposuction for the trunk and abdomen covered. UHC states that they will cover liposuction for the trunk with CPT code 15877, which is better than Cigna. Most plans will not cover a panicolectomy or an abdominoplasty for lipedema. Those are also known as a tummy tuck. We typically win coverage for abdominal surgery with an appeal while our members are proceeding with their covered surgeries. UHC doesn't explicitly cover skin excisions in this policy. Most other plans do cover skin excisions. However, we have won excision coverage against UHC on appeal because excisions are reconstructive as defined by other UHC policies. We always provide enough support in the coverage request so our members should not have to appeal a denial. However, we have also won almost all of our appeals for excision coverage and have had self-funded employer plans step in to cover this part of the surgery. The UHC policy requires confirmation of lipedema by a primary care provider, a PCP, or a vascular specialist. This from the policy. Assessment by the referring primary care provider or specialist in vascular conditions, different from the treating surgeon, confirms that lipedema is an independent cause of the functional impairment, interference with activities of daily living, and the surgery is expected to restore or improve the functional impairment. Many PCPs do not understand lipedema. In our experience, we have only been able to get support from a PCP in about half of the cases. We have a template letter for our members and supporting information to provide to a PCP. Some surgeons are also willing to speak with your PCP. We also want to note that if you have a PPO plan, there's no reason that the primary care physician can't be a different physician who specializes in lipedema, but is not your regular primary care physician. We have a list of physicians who are experienced with lipedema, and we constantly add to this list and hope to eventually have one in every state. This list is available to members of coverlipedema.com. More troubling is the suggestion of an assessment by a vascular specialist in the UHC policy. In our experience, vascular specialists are the opposite of plastic surgeons in their focus and ability to bill insurance companies for procedures, and they tend to get paid very well through insurance. We have seen many women with lipedema go to these specialists where they have thousands of dollars in vascular procedures before they even get a lipedema referral for surgery. Many lipedema surgeons take the position that removing the lipedema takes the pressure off the veins and can resolve many vascular issues. So we recommend that you consult with a lipedema surgeon before agreeing to vascular surgery. We believe that the requirement for a vascular specialist creates an undue burden on insurance plan members and risk for unnecessary procedures. Since lipedema is more of an endocrine issue, excluding endocrinologists, as well as physicians like Dr. Ade at Vanderbilt, who's a cardiologist involved in lipedema research, just does not make sense. We have already reached out to UHC about the vascular specialist requirement. We are going to keep pushing UHC on this point, but we still think having a non-surgeon lipedema expert can be very helpful in a coverage request to confirm your diagnosis and to convince a PCP to support the surgery. The UHC policy requires that lipedema is an independent cause of the functional impairment, interference with activities of daily living, and the surgery is expected to restore or improve the functional impairment. At coverlipedema.com, we recommend that our members have an independent functional capacity evaluation, or FCE, so that they have a strong coverage request to meet this requirement. We work with a company that can schedule FCEs specifically designed to demonstrate the functional impairment of lipedema. They can be scheduled nationwide through our recommended provider. The UHC policy does not address the issue of the lack of network surgeons. Historically, UHC has been reasonable about the lack of experienced lipedema surgeons in its network, but recently we have had to press hard to win coverage of out-of-network surgeons by appealing to state regulators and employers. This has been a consistent theme with many of insurers, so we now recommend, if you are not using a network surgeon, that you find the closest qualified out-of-network surgeon. If your preferred out-of-network surgeon is not a board-certified plastic surgeon, it's hard to argue that they have more experience than an in-network plastic surgeon who is board-certified. Certain states, like California and Ohio, have network surgeons who claim they treat lipedema, when actually they have no interest in treating the disease and may not be the best qualified to perform liposuction. Still, insurance companies will insist that you seek treatment from them. If you live in those states, it's going to be very hard to get fully covered for an out-of-network surgeon. It's better to travel to states where there are no network surgeons than to travel to a place like California or Ohio, where all the major plans are now stating if you can travel for an out-of-network surgeon, then you can certainly travel for an in-network one too. Like many insurers, we have had issues with UHC processing coverage requests that members submit with out-of-network surgeons. UHC is particularly difficult to deal with because they're very large. We help our coverlipedema.com members monitor their packages, and we will reach out at UHC at the state or national level to correct any processing issues. We have found that insurance plans with coverage policies often seem to delay the coverage and network contracting processes, possibly to have women give up and pay cash. We use our connections with state and federal regulators to encourage insurers to act quickly, and we have informed several state attorney generals of our concerns about processing speed. If you have a self-funded employer plan, we can help you explain to your employer why your employer should get involved in your coverage request. We have mixed feelings about this policy for UHC members. We are encouraged that denials will no longer be based on liposuction being unproven or experimental as a treatment for lipedema. But we are still very concerned that the policy will allow UHC to find other reasons based on their criteria to deny patients either completely or partially. This means that more than ever, a well-supported coverage request package will still be necessary to get covered. Additionally, this policy does nothing to resolve the issue of lack of qualified network surgeons. Just because UHC has a policy does not mean coverage of your lipedema surgery will be any easier. Most other major health insurers have lipedema policies, and it's not easy to get covered by them with the surgeon of your choice. The coverlipedema.com process assists its members with getting to the surgeon of your choice, which of course depends on your insurer, your type of plan, and your state. For coverage, we guide you in creating a well-supported coverage request package. For appeals and network requests, we provide the knowledge, connections, and documentation that is required to win. We offer free strategy consultations that can be scheduled on our website, coverlipedema.com. You can learn more about us at our website, which is coverlipedema.com, our Facebook group, which is Cover Lipedema, Insurance Coverage for Lipedema. We have free telephone consultation appointments to discuss how we can help women get covered for lipedema surgery, and the direct link for that is coverlipedema.com/appointments. And you can also contact us via email on our website.